right, here we go. First live of Mobility Agility Chiropractic Performance. Let's see if we get... I'm a little early. All right, so as people start to pop in and join the live, make sure you hit the like button or comment #replay to let me know if you watched it on a replay. I'm going to start off with some questions that I'm just asked fairly frequently and go from there. As people come on live, they might post questions and we'll answer them. If you have a question that comes up and it's after the video is done, go ahead and ask the question, #replay, and I'll answer it. I'll just add a comment to your question. That way, everybody gets an opportunity to ask their question. We're also going to be doing these videos weekly, so that'll be super nice and easy for people to have access to them. Now, let's see. Oh, hey, Tim. Thanks for joining. So our first question that I have is, I'm not an athlete, can I still see a sports chiropractor? And the answer is absolutely. Sports chiropractic isn't just geared towards athlete. It benefits them as it helps them with performance, but as a non-athletic person, it benefits you because it can help you become active or get you out of pain and provide you with rehab exercises to do at home. So it's a really great modality that brings something different, that you don't have to be an active person to utilize a sport chiropractic service. So I'm a sports chiropractor. I did a 2-year fellowship and specialty training at Northwestern, predominantly with female athletes. That is my true passion. Hey, Megan, thanks for joining. And if either of you have any questions, go ahead and comment and hit like so I know you're watching. So, sports chiropractic is for everyone. My second question that I get constantly is chiropractic safe? And the answer is yes. Hey Liz, thanks for joining. Chiropractic is safe. The most common thing you see in the news media concerning chiropractic is stroke. And yes, that is a big concerning problem. But here's the thing. When you're having a stroke, you're having symptoms of neck pain, headache, and those are all things that can lead you to coming into a chiropractor's office. So it's important that when you get in there, the chiropractor does an appropriate exam. So when you come to Mobility Agility Chiropractic Performance, all you have to do is answer the questions honestly, let me know what's going on. So I'm going to ask questions like, is this the worst headache of your life? And if the answer is yes, then this probably isn't the right place for you. You need to go to an ER and have an assessment. So when it comes to chiropractic, it is absolutely safe. And I like to look at our malpractice insurance. Our malpractice insurance is who, if someone decides to sue us because of a screw up, sets our rates. So on average, a provider of any sort, whether it be a medical doctor, a chiropractor, or a dentist, needs $1 million to $1 million coverage. For a family practice doctor, that runs about $10,000 a year in malpractice coverage. So they have some risks. Versus as a chiropractor, my malpractice is $1,400, $1,400 for the same amount of coverage. So really, when you look at it from that perspective, the person that sees us as the biggest risk is the person that sees us from the biggest risk is the news media. The person who assesses our risk is our malpractice and see us as a very low risk. Hey Rachel, welcome to the video. And that's where chiropractic really is a safe modality for managing your pain. And when it comes to the medical community, they don't have as many options. They like to use opioids, they like to use medications, and those all come with risks. So when it comes to chiropractic, we are a safe opportunity for you to get musculoskeletal care and have less pain. Now, the final question I have is from someone that sent me a message. They said they couldn't make it, but they wanted an answer. So they're going to come back and watch this later. And it was, they have increasing numbness and tingling down their arm, and it has been getting worse. They think it's something called thoracic outlet syndrome. Pretty sure they Googled it. And they want to know what they can do. Well, first and foremost, they need to go see a chiropractor. They need to go see a physical therapist. They need to get assessed. But in the meantime, they can do something called nerve flossing. And this is a really simple stretch that will allow them to have some relief. So, first one is you lean your head in, you lean your head away. Now, this might cause some numbness, tingling, pulling into your pinky, and that's normal. The other ones are with your arm, you either go away and in, and you just kind of move those nerves in your neck back and forth. That can help alleviate some of the symptoms, especially if they get really, really tight. So that can help with any numbness or tingling that you're having. So does anybody else have any questions? Because this is really an opportunity for you to get some free advice while we're sitting here live. I know we've kind of covered, is sports chiropractic for everyone? Yes. Is chiropractic safe? Yes. And if you're having numbness and tingling, there's stretches you can do at home. Mobility, agility, chiropractic performance I find it very important to make sure that whatever we do in clinic, you're provided with something to do at home to manage your pain. Some exercise, some stretch, some activity. I don't want you reliant on me and feel like you have to come in for hours every week to get care. I want you to be able to take care of your pain at home. Oh, and we have a question. All right, my neck gets tight very easily. I'm prone to headaches. What are some stretches I can do at home? Ooh, so what's really nice is I made a YouTube video for stretches that are follow along. But for right now, some easy stretches you can do are to tilt your head, lightly place your hand on top just to deepen the stretch, and then hold for 30 seconds. And you would do this on both sides. Now what's fun is there's a lot of muscles in the neck. So after you do both of these, you go back to the first side, you look down, and you hold that stretch. You can look up and hold that stretch. Those 3 different positions will allow you to have all the neck muscles on the side relax. Now, if you're sitting at a desk, you probably sit like this. And that is called anterior head carriage, and that can trigger headaches. So what you want to do is make sure you tuck your chin in, give yourself some nice double chins, so attractive, and just activate the muscles in the neck. That'll help you get into a spinal neutral. So a nice safe space for the spine and help stretch the muscles in the back. I'm not saying walk around like this, but if you want to lay down and activate those muscles at the end of the day, that can help alleviate some of the tension headaches people get. All right, we have another question. What are some of the best foods for anti-inflammatory, and does this help with circulation to reduce tingling and numbness? Okay, so what are some good anti-inflammatory foods? Well, let's talk about some inflammatory foods. So the foods that just make everything really hyped up and can cause issues. One of the biggest ones, sugar. And sugar is found in just about everything with carbs. So you want to make sure you first pull out those sugars, pull out those refined carbohydrates to help eliminate some inflammation. There are some other foods such as corn, anything processed basically comes in a box and you easily heat up that can cause inflammation. But as for anti-inflammatory foods, you have your dark leafy greens. You also have turmeric, garlic are some great options, but those foods can react with some medications. So make sure if you're taking any prescriptions that you go out and review with a healthcare provider before you start taking any supplementation. So turmeric, garlic, omega-3s, and vitamin D are always really good for kind of eliminating some of those inflammatory items and can help you recover. I personally like Nutridyne or Standard Process for my supplements. I don't necessarily like going to Walgreens or Walmart to buy supplements. They've been having some issues with quality control. So I like to go to a company and find the best products so that you have the least amount of likelihood of reaction. Does that kind of answer your question? Perfect. So, any other questions? Are there any exercises people can do before they go in for a more effective adjustment? So, when you're coming in, I want you to come in to the office wearing clothes that you can move in. This way, if we need to stretch or apply some soft tissue to ready the area for an adjustment, we're able to do that. As for what you can do at home, stay warm. Get in and take a nice hot shower, get the muscles nice and loosened up. Having them already warm really helps allow the adjustment to set in and really stick a little bit better. I mean, there are times no matter what where it's gonna last for only so long. I mean, especially if you're out playing hockey and get boarded, probably not gonna last all that long. Not that I can think of anybody watching the video that could happen to. Rachel, that one goes out to you. So just recognize the fact the warmer you can be, generally the easier the adjustment will go in. So, yep. Any other questions? Hi, Aunt Susie. Thank you for joining. So I hope this video has kind of been helpful for explaining what chiropractic is, getting some general questions answered. I plan on doing these weekly. I'm going to mix up the times to see if I can't find one that's easiest for everyone to attend. So if you have a recommendation for when the video should be next week, go ahead and post that in the comments. We have a couple more questions. What exercises do you recommend for people who are heavier with more weight sitting on their joints? So when you're dealing with a little bit more weight carrying around, for whatever reason, you sometimes have to make some modification to some exercises, and really not too many modifications. If you're having joint pain and knee pain and hip pain with certain exercises, we can offload those by putting you in the pool to help eliminate some of the stress on the joints while we're getting some of the weight down. The other thing that we can look at is modifications to what you're eating. As my father has always said since growing up, and he's absolutely right, you can't outrun your fork. So first place we want to make some modification is to lifestyle. And we look at what meal plan and what modifications we can make that work for you. Because no one diet is perfect for everyone. Keto doesn't work for everyone. Mediterranean doesn't work for everyone, vegetarian, whatever diet, we have to find the one that works best for your body, and we need to make it a lifestyle change. And then as the lifestyle change progresses, then we can add and modify different activities. I honestly, unless you're having significant pain, there isn't that much modification to an exercise that needs to occur just because of weight. We just need to get you moving. I hope that kind of answers the question. I like to keep things as open and active for people so that no matter what level of activity they come into, we can work through it and get you to the place you want to be. I know for myself, I have a huge issue with committing to going to the gym. I can find every excuse in the book, and then when I go back, I go a little too hard, and the next day I feel like absolute heart garbage because I went too heavy. I tried to do what I had been doing 6 months ago, and it's really important to scale, and I have to remind myself that. So when it comes to modifying exercises, you just kind of have to listen to your body and do what's best. All right. Next question. Are there any gadgets that people purchase that are actually worthwhile? What do you mean by gadgets? Like soft tissue gadgets, workout gadgets, exercise tracking? I know for soft tissue, we have a lot of vibration therapy units going on right now. Ooh, there we go. Like neck pillows. Okay. So is there any like health gadgets that are good? Example, like neck pillows. You know, I'd like to say there's the perfect gadget that fixes all things. There isn't. Everybody's different. The thing you need to consider is your shoulder to neck ratio when picking a pillow. And I like to find the one, and whether you're sitting on your, sleeping on your side, sleeping on your back, the important thing you need to think of is my spine in line. Once you find a pillow that helps you keep that spinal neutral and doesn't cause any pressure on the muscles, you're going to feel more comfortable when you sleep, and that's the gadget that's going to work for you. So there are different health specialty things out there that'll work for some people and absolutely won't work for another person. Second blog in February, so the third week in February, I'm going to be posting about how to purchase a mattress. And I'll toss in some content concerning pillows. So let's see. What is your experience of trying different diets? Ooh. So I personally have tried Weight Watchers. I have tried keto. I have tried Mediterranean. I have tried, what is one of those mail order diet thing, Nutrisystem, I think. So I've tried a bunch of them and they just don't work because they're not sustainable for me. I recognize the fact I am high strung. I have a tendency not to put my health first because I'm a workaholic. So I've had to come up with different methods of meal prepping, but I don't like to meal prep for an entire week because then I won't eat the meals later on in the week. So I'll meal prep for 1 to 2 days. I like to freeze meals so I can just pull them out and heat them up. But right now I'm kind of eating a more moderate lifestyle, which is I eat what tastes good and I try to make it as healthy as possible at the time being, and then just maintain activity. So I recently rejoined a gym up in St. Louis Park. It's Soul Studio. It's a very female-friendly gym with yoga and Pilates and Zumba classes and some strength training. It's a lot of fun, and I'm excited to announce that starting in February, I actually will be partnering with them and treating out of that facility every Thursday. So if you're interested in, I do have some 1 week free passes let me know and swing by the clinic and I can get those to you. So it's a really fun gym for you to join. And then my experience with those diets, not good. I lost weight and then I immediately gained the weight back and it was a nightmare. Let's see, I saw another question. Ooh, or different thing. Let's see. With being in the new year, there's a lot of people with New Year's resolution. What is a common mistake? Trying to read the whole question and it's not coming through. So give me a moment while I investigate. What is the most common mistake you've seen? Most common mistake I've seen with New Year's resolutions is thinking the resolution is going to fix everything. And really, we start out a new year really committed to that resolution. And then within like 2 to 3 weeks, we slip back into our old habits. It takes about 21 days to make a change and 90 days to set a new habit or lifestyle. So I would much rather see people take the steps to change their life and do something different without the pressure of a resolution. So this year, for my clinic and my personal life, I chose a word, perseverance, to live my life by. So I'm going to persevere and push through and grow my business. I'm going to persevere and get myself in shape. But I know that with perseverance, it takes time and there's a delay until you get gratification. So I'm using that to help kind of build myself up as the year progresses. And then I don't have, I want to lose 20 pounds. And then I don't make that goal. Or I want to read so many books and I don't meet that goal because of busyness. I have a word that I'm going to do my best to live 2020 by and see if that helps. All right, next question. Any suggestions on an exercise regime for someone who has an autoimmune disorder that causes extreme exhaustion? Ooh. So for that is a challenging one because every day is going to be different. Every day, some days you're going to feel really, really good. Other days you're going to battle with your body. A place I like to start is yoga. Yoga is generally safe and you can pick different routines from a strength yoga to a relaxation yoga. So on more fatigue days, you can do a more relaxing form and still get the work in. Soul Studio has that. I also like the flexibility of doing yoga online. So I like to go to YouTube and search for different yoga classes. One of my favorite channels is Yoga with Adrian, not sponsored. And I love what she does on there when it comes to, I need a 5-minute workout. I want to do a 40-minute strength training. That way you can kind of pick what your body's feeling like. Now, as you progress and become more fit, your energy will increase. And that might help fight some of what's going on with the autoimmune. So the more active and controlled you can get to kind of help build your system up might actually help give you more energy to expand your workouts to include maybe running or strength training. Granted, I don't run ever. I will lift weights faster before I will run. So whatever your goals are, start as small as you need to achieve them. Okay, any other questions before we sign out for today? Again, please feel free to post a day and time that might work better for you. If you're watching this on replay, add the hashtag replay. You can still ask questions. I will happily go back and answer them after this video is done, just to make sure everybody gets the answers they need. And I think that's going to be it for tonight. I want to thank everyone who joined, and welcome to Mac Performance. It's weekly live video. Just remember, we're always trying to get you better faster, keep you better longer, because no one has time to be sidelined. Have a good night. To keep up to date with future content, please click subscribe. Additional information is found in the description of this video.
All information, content, and material of this video is for information purposes only and are not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider.